I'm Brian Schofield. I'm Operations Manager at IEE Global. IEE Global manufactures explosive equipment for use in the mining industry across the world. We design the equipment in-house. We have our own specialised fabrication area, including a laser cutter, special rollers, presses. From that, we fully manufacture the equipment. We then paint and fit the equipment up. The equipment is sold to most mining companies across Australia and around the world.
I'm Tom Shannon. I'm a urologist at the Prostate Clinic. I've been in practice for about 20 years, specialising in prostate cancer. The Prostate Clinic was created to bring together all of the people that we need to help men through the journey with prostate cancer. The biggest issue for us is early diagnosis, and that comes down to awareness. It's been critical in Australia to have the Prostate Cancer Foundation to be that peak body to drive quality and outcomes. And PCFA, which was started by a man who was diagnosed too late with prostate cancer, has been a great source of support and information for men and for doctors and for specialists like me.
I have a family history of cancers. Prostate was diagnosed in my father back 20 years ago. It wasn't too severe. However, 10 years ago, one of my brothers had a very bad case of prostate cancer. I was having regular checkups with my doctor for PSA readings.
PSA is a blood test looking for prostate-specific antigen. And so the guidelines say quite strongly that there's a benefit in having a PSA test over the age of 50. If you've got a positive family history though, and it may just be an uncle, brother, father, even one of those, your risk goes up quite a lot. So there's a strong recommendation that you start from a younger age, say 40 or 45. It's important to realise that PSA is not an absolute. The way I'd like to describe it to patients is that a high PSA is like a red flag going up. It means go and check that man, there might be something going on. So if it stays high, if we just think about that red flag says this man's got probably or could have cancer, you need to do some tests to make sure that you don't. And for most men, that's an X-ray with an MRI. And then for some men, it's a biopsy after that as well.
I went and visited Tom at his premises. He then sent me for a biopsy. Tom indicated that I had prostate cancer. His recommendation was I would have my prostate removed.
So it's really important to understand that most prostate cancers don't have symptoms. And that's probably quite easy to explain if we look at this model. This is the prostate here, and this is where we wee. So to get any symptoms to the waterworks, there needs to be some restriction here. But most of the cancers are actually a long way away from that. So most men with prostate cancer have no symptoms. It's quite sneaky that way.
When I was diagnosed with prostate cancer, Tom referred me as to be overweight, and he needed me to lose some weight before he would perform the operation on me. He needed to operate on me in a fairly short time, so he sent me off to lose 20 kilos in 7 weeks. I managed to lose 27 kilos in 6 weeks. I have put a little bit of weight back on since then. I still feel better. I still exercise every day, walk 8 kilometres before I come to work, before anyone gets up.
Well, because we don't really know what causes cancer, it's hard to say do this and you won't get prostate cancer. But in general, there's 5 things that we can do that reduce our cancer risk. The first is to make sure that we're a healthy weight, and if you measure around a man's tummy, it needs to be less than 95 centimetres. Above that, you increase your risk of cancer. Having a really good diet is great, so lots of fruit and veggies are very protective to cancer. Don't smoke, that's pretty obvious. Minimal alcohol. We don't know what the safe level is for alcohol. It's probably 0, but I encourage men not to drink on most days and less than 2 standard drinks on other days. And exercise. Exercise reduces your cancer risk quite significantly. But to do exercise, you need to be following Australian guidelines, which is 5 times a week aerobic, 30 minutes, where you're puffed, and lifting weights twice a week as well. If you do those things, you can reduce your cancer risk by maybe even as much as 80%.
For all men who are at risk with prostate cancer, I think we should go for a regular checkup with our doctor. So put it down as an anniversary, so go and see a doctor on your birthday, get your PSA checked, check everything else. If there's an issue, work around it, go and see a specialist and see what you can do moving forward.
Technology these days allows us to treat prostate cancer without the consequences that we used to have. It's a lot easier as a journey, but to get you through this free of cancer and to keep your function, it's so critical that we find things early. There are a lot of things that are very close to the prostate that determine whether or not we keep erections or keep water control working. And we don't have much time between a cancer starting and a cancer damaging those structures. So early detection is probably more important for prostate cancer than it is for a lot of cancers.
I think prostate cancer is not the bad killer that everyone thinks it is. I think most people nowadays can survive prostate cancer as long as we monitor our health and we pick it up nice and early.
The big difference between this generation and the generation before is we're going to live a lot longer. And at the moment, a lot of people are living for 20 years with chronic illness. So to stop that happening, we do those 5 things we talked about, but you're also very proactive about finding things early. No matter what, you're probably going to live till you're 80. Do you want to be healthy when you're 75 and still enjoying life and going on walks and doing all those things, or do you want to be, at home and sick? And you get to decide that, when you're about 50 or 60.